types of accidents. Number one is accident. Number two is basically these are the four types of incident, but incident and accident both basically are the same thing. Incident basically means a happening, any sort of happening that could occur in everybody's life. So there are we are talking about health and safety too. So in this sense, an incident means an unwanted or unplanned event that could result in damage, loss, or even death. So there are four types of incidents. Number one is accident. So accident is basically an unplanned, unwanted event which leads to injury, damage, or loss. So like a car accident, what happened in that? The car will hit somebody, and the person who is being hit can be injured or can be dead. So in type of a loss, for example, if something or some material is improperly stored and it falls down, basically it is an also example of accident. But in this accident there is no loss or injury, there is no injury to a person but loss of material. So this is also an accident because it is unplanned and unwanted event. So accidents have two types basis of the examples that I have given and the scenarios that are given above. So the number one is injury accident and number two is damage only accident. So as they are sounded from their um, headings, injury accident means is an accident which leads to an injury. So its definition is that unplanned unwanted event leading to personal injury like hand cut or breaking of bones or like that dislocation of shoulder etc. So second is damage only accident. So damage only means that there is no injury to a person. Damage only it suggests that damage is only happened. So what kind of damage can happen if it is not you know harming a person? So damage could happen to equipment, damage could happen to machineries, infrastructure, and so on. So damage only accident means is that unplanned unwanted event leads to equipment damage but no personal injury in these types. Like for example a wall is demolished, or like for example if a gas leak has happened, so this gas leak could result in a big hazard, loss of chemical. Like for example if an oil is spilled, then it is loss of precious material, expensive material. And the second is near miss. The second type of incident is near miss. So as it sounds from its heading, near miss, like nearly missing accident. The accident could have happened but it missed. So its definition is that an unplanned unwanted event that had potential to lead to injury, damage or loss but it did not happen. Like for example if a gas chamber or gas plant was leaking but it was controlled effectively, it was reported and active monitoring was happening on site and it was controlled effectively and corrected effectively, so because of which an accident could have happened, that chemical could have taken lives, that chemical could have damaged the plant, the equipment, the infrastructure, but it was controlled effectively, so it was a near miss. So the third type is dangerous occurrence. Dangerous occurrence, near miss means it had a chance to of an accident, but dangerous occurrence is a most severe form of near miss. It is also an accident. In this accident, it could have impacted to a wide area, to widespread area or wide number of people. Like for example, if a gas, if a harmful toxic gas would have released from a plant, then it could have affected the surrounding neighborhood, all hundreds or thousands of people on site, all the surrounding areas. If it was flammable, then it could have damaged a lot of building houses and even cost hundreds of lives. Because this is a type of event which had a very great scale of impact. So its definition is that a specified event that has to be reported to relevant authorities by statute law. It is major gas leak. Its example is like major gas leak that I have explained earlier. So number fourth is work related ill health. So work related ill health. So what kind of ill health? Ill health means basically a disease. What kind of disease can be related to work? Like for example dermatitis, or if there is a chemical leak, then like for example if in a plant there is or in a lab there is a leak of radiations, then this radiation could have caused cancer to many people that are impacted on site. So this is a work related ill health. Its definition is that a disease or medical condition that is directly attributable to work. Like I have gave example of that. Like for example if there is a lab and it has um, radioactive materials and it is releasing radiations constantly, and for example we have collected a lot of radioactive material in a lab and it somehow it gets radioactive decay and it spreads, then it can affect a lot of huge area. Likewise if there was a oil refinery and it got ignited or it resulted in burning or bombing or like that stuff, so it could affect a lot of area. So now it is next topic, level of investigation. So what are the level of investigation? What is the level of investigation that is required in health and safety? So basically there are four levels depending upon their requirement, depending upon the competency of person, depending upon the time and effort. So these are described as four. Number one is minimal, low, medium and high. As their name suggests, minimal is, it is number one, it is below low. Like it is not very high, it is not medium, it is not low, but it is below low. So what could be below low? Like in companies, the first step is worker and above that is line manager or the lowest management. That definitely a worker can't do investigation. So who will do investigation? The lower line manager or lower management. So it requires immediate line manager and not excessive time or support. So it is named as minimal. Next is low. So low is greater than minimal, in which definitely as it is low, so we will consider the lower management chain in an organization. So we need low line manager with some support and more time and effort. So with some support and more time, it increases from minimal to low level. Then we have medium. Definitely we have, and now as we are going down and increasing, as this hierarchy is increasing. So medium definitely, like in an organization, the medium means middle management. So medium level of investigation can be conducted by middle manager with support and significant time and effort. Definitely suggesting from the word high. High means what is high level of investigation that can be done in an organization. Definitely it could be done from the senior management that could oversight with team based approach and significant time and effort. Definitely it could be long, like audits and that stuff, or changes in policy. So what are basic investigation procedure? So if a person is doing investigation, so what will he do? What will he consider? The first time he will go to the site to do an investigation. So first of all he will make sure that the area he is going to do investigation of is clear. Like for example, if there is an area which has currently constant flow or release of harmful chemical, and then we can't do investigation there. If we are present at that time at that area, then definitely we can also be effective, and we can also get harmed from the chemicals that are being released in that toxic environment. So the next step is first of all is safety of the scene. We will ensure that the area is safe to approach. After that, we will check what immediate actions are required. Like for example, if there is a wall and it is releasing harmful gases constantly, then we will first of all turn off the wall before doing anything else. And after that, we will go to do immediate action needed. Like we will approach the casualties or the injured person to give them first aid and that stuff. The second stuff is casualty care. It could include first aid treatments, hospitalization, and that stuff. Basic investigation procedure is there are 4 steps of investigation. Number 1 is gather factual information. We will go to the site, we will gather as much as possible factual information, evidence that will help us to get data to do proper investigation. The second step is analyze the information and draw a conclusion. After that, we will analyze the information that we have gathered from the site, and we will draw conclusions from it. We will find what was the reason of that accident. We will find immediate and instant causes, root causes. And the second step number 3 is identifying suitable control measures. Then after that, when we have identified the information, identified the root causes, issues, after that those issues can be sorted out, those issues can be corrected, then we will do suitable control measures. We will take suitable action, suitable precautionary measures to prevent further such repetitions in future. And number 4 is basically number 3 and 4 are linked to each other. Like number 3 suggests identify suitable control measures. In this, we are not actually taking suitable control measures, we are just identifying that from 1 and 2 we have gathered information, we have found all have taken all the analysis from the information, we have drawn conclusion. Now number 3 is we are just identifying what could be the possible suitable control measures to prevent further such actions in future. In the step 4, we will plan the remedial action. Now we will also do implementation as well, because 3 and 4 are just too mixed up. So understanding is that in 3 we are identifying suitable control measures. So we are just identifying suitable control measure what we could have do, and in step 4 we are planning that we will do this to stop future such actions. So 3 and 4 is basically an implementation step, and number 3 is just basically planning, like we do plan, do, check, act step. Number 1 is gathering information, and now it is detail of the step 1 of investigation. Now we will secure the scene, we will identify witness, we will collect factual information, we will interview witness, we will examine all the documents like risk assessment, like police accident reports and that stuff. All the data we could find possibly that would help us in an investigation. After that, we will witness. So we will interview witness. So interviewing witness also has a proper procedure in which it requires that there must be a quiet room without distraction. Like for example, if we are interviewing 10 people at a time, then they all will know that what is the answer of number 1 person, and he was saying that, and if I will say that, the interviewer can blame on me, put blame on me that I'm saying wrong, or I'm a lawyer, or that liar. So for that purpose, to end confusion, to do it transparency, and to do it with transparency, we ensure quiet room without any distraction. After that, we establish a report. A report is established in which everything is written. After that, we explain the purpose of this interview to the witness. We tell him that this is not to blame him, this is not an investigation to put blame on the person who is giving his testimony, but it is only to find the root causes of that accident and to prevent further such accident in future. So we will use open question, we will not ask confusing question or tricky question or which have multiple answers. We will just, like for example, who, what, where, we will definitely ask them to the point and straightforward question. After that, we will keep an open mind. Like if the witness is saying something and we are distracted by, or we are thinking something else and we missed what he said. After that, we will also take notes. We will write what the witness is saying, and we will also ask for a written statement from the witness at the end. Then we will thank him. We will thank the witness for his cooperation, because definitely he has given his time, he has given energy, and now he has properly gave his testimony, which is very helpful to save lives in future. So definitely he requires a little appreciation. Document examination. After that, we will examine the documents that are present in the organization that could have been the possible causes of health and safety crises or health leading to accident. For example, if a permit to work system was not properly implemented on site, then this means that document could indicate the possible causes, the people who are responsible for that accident, the basic reasons, the root causes, and it would the failure of precautionary measures, the issues, the lack of supervision. So that PTW can give us a lot of overview for possible root causes or failures to control measures. So we'll examine like company policy, risk assessment, training records, safe system of work, permit to works, maintenance records, previous accident reports, sickness and absence record. As if there are regular sickness of workers on site, then this indicates that sickness and previous records. Sick, if there are constantly sick people on site, then this would indicate that, like for example, if a person has been sick 6 months ago, and like there are constantly sick people from the same condition, like everybody is having headache on site, then this means that there was a constant leak of, for example, we can say there was a constant leak of gas but in less amount, which was resulting in sickness or headache, or like a leak of radioactive material that had caused some cancer to people. So that could definitely help us to identify the real root cause of an accident. Step number two is analyzing information. In this we analyze immediate causes and underlying root causes. Basically, immediate causes are that causes which are found by the investigator at the first instance. They are basically his thoughts that this would be the possibility leading to accident. But when he do proper thorough investigation, then his point of view changes, and he finds basically he has, because he has a wide overview of the accident, then he can identify several root causes. So that's the basically difference between immediate cause and root cause. So immediate cause are basically unsafe acts, unsafe conditions, and underlying root causes will give us detail of what had actually happened or what could have actually been possible reasons for that accident. For example, no supervision, no PPE provided, or no training. After that, step number 3 is identifying suitable control measures. So we will identify suitable control measures that could have been applied and that are needed to be applied in future. So we will do it for immediate causes and for underlying causes. Like for example, if there was a oil spill, then immediately the oil must needed to be cleaned, and its root causes we will check that there was a hole in the oil tanker or leakage in from pipes or improper transportation of oil. Then we will try to find and investigate and then solve those root causes. Step 4 is planning the remedial action. So planning in this phase, we and the senior management sits down and plans, discusses solutions, and takes actions like provision of resources or hiring competent person of training of workforce and that stuff, that would definitely help in reduction of such accidents in future. Dangerous condition must be dealt with immediately, like we will plan that all the danger there are dangerous commission the senior management would plan that the dangerous condition must be dealt immediately. After that, interim actions may be possible, like what can be the future actions or primary actions that are needed to solve those immediate causes. After that, underlying causes, like underlying causes is basically the second name for root causes. It is the same thing. Root cause, underlying cause, it is the same thing. It requires more complex action definitely to solve or to end a root cause. A proper thorough investigation or proper system must be changed, and it requires a lot of work. It will take a lot of time, effort, disruption, money, we must also prioritize what things must be done at what time and at what rate. After that, recording and reporting. It is required by the ILO's recommendations and conventions that if an accident happens, then it must be reported to regulators. It must be conveyed to the injured person's family and so on. So basically, what is recording and reporting? Reporting is the process of informing people that an incident has occurred. Can be internally within the organization or externally to enforcing auditors or issuers. Recording is the process of documenting the event. So what is reporting? Reporting, you can report to the state agencies, we can report to media outlets, we can report. So like there is a major gas leak in a town, then if we report it, then more people will evacuate it or keep precautionary measures to stay safe. Internal incident reporting system. There are two types of reporting system. First is internal and second is external. Basically, internal is if something happened, some type of accident happened in an organization, the worker will report it is to his senior, like worker representative. He will report to health and safety manager or any senior management. That can be reported internally, like director, senior manager, HR, health HS advisors, worker representative, etc. And external reporting is basically the real time reporting, because it is more valued, because family of casualty must be reported. Like it is important to report to the casualties family members that something has happened to a person. After that, we could report to reporting must be after that we could also report to external authorities. Like external authorities can be insurance companies, fire department and that stuff, or basically the companies, country, state regulatory bodies like police and other health and safety investigators. So incident recording and accident books. Accident book. What is basically accident book? As it is suggested from its name, it is a book in which accident records are kept. So to record an accident in the accident book, we have to keep in mind these given standards. Like for example, we have to put the name and address of the injured person, date and time of the accident, location of the accident, detail of the injury, details of treatment given to that injured person, description of event causing injury, details of any weapon substance involved, witnesses name and contact details, details of person completing the record and signature. What are the externally reportable events? Basically, the externally reportable events are, in simple words, all the events which are above first aid category or which require more than first aid. Like for example, a major injury, fatality, dangerous occurrence, disease, lost time injuries, etc. Lost time injuries. What are lost time injuries? Lost time injuries are basically those injuries. For example, worker A was injured from 8 to 9 and he will now not be able to come in the next 3 days shifts, so his time is lost. So this injury is causing loss of time of that person, so it is named as lost time injury. Number 3, now next step is auditing. Auditing is basically the most important step of health and safety. It can be internally and externally with its limitations and barriers and benefits. Internal and external both have some benefits and some limitation. So what is basically the definition of auditing? Auditing is the systematic, objective and critical evaluation of organization health and safety management system. So systematic means a system is followed in this. It is not like a regular we will do first step, like one I will do the last step in first place, second step I will just start making notes, I will just start asking question, I will just start looking at machines. No, we have a proper system. There are 3 steps. So there is pre-audit preparation. After that we have during audit, and thirdly is at the end of the audit. But we will discuss it in upcoming time. So systematic, objective. It must have an objective. So what can be the objectives of an audit? Definitely the objective for an audit in an organization can be to reduce accident, to find issues that are leading to accident, to find issues that are leading to loss of materials, casualties and that stuff. So we must have an objective that or target that need to be fulfilled after an audit, or to check the progress, or to check whether we have met with the requirements or not. After that, critical evaluations of an organization health and safety management system. Basically, in audit, the most important part is the organization health and safety management system, basically which is OHSM, in which we have planning, evaluation, action for improvement, and that stuff. So all of that is considered in an audit, and it is checked whether it is being followed correctly or not. So basically, first of all, I will give you a little intro to occupational health and safety management system. In that we have 5 steps. Number 1 is policy. Number 2 is organizing. Number 3 is planning and implementing. Number 4 is evaluation, and number 5 is action for improvement. And all these steps are checked by audit, whether policy is being followed or not, whether organizing, which means rules and responsibilities are assigned. Like we have only workers and one manager, like 100 workers in a company and only one manager, then it shows that the proper organizational arrangement has not been done, that could have been improved. Planning and implementing, in which detailed arrangements to manage health and safety are done, risk assessments are done to do the jobs without risk. So if there is no planning and implementing, then it is just an irregular work without any proper organizational structure and occupational health and safety management system. Then it means that it is violation of that OHSM. Yes. And after that, at the end, we have to find what actions are needed for improvement, and all of like what we can do to improve what was wrong and what could be improved, and to end the accident rates, sick absenteeism, worker lost time, or that stuff. That all can be reduced, and what are the action required to reduce them. So all that can be checked from audit. Now we come back to audit. So audit and investigation, they both are different things. Inspection is a minor thing and audit is a major procedure. In inspection only the workplace is checked, records are checked. It is very quick and it is very less costly, and after that it only requires basic competence. And it is basically part of an audit, because audit is a superior procedure, superior investigation procedure, superlative in degree. In inspection only physical reality of workplace is checked, but in audit the management system is checked. So checking management system is a very big deal, and it involves a critical, systematic, objective, and that stuff view overview of an organization. So basically in audit we have to examine documents, examine procedure, interview worker, verify standards, check the workplace. Can be long process, it can be expensive, it requires high level of competence. A simple person with basic knowledge or basic worker can't do it. It required high level of qualifications, certifications, and knowledge, so that a proper audit can be conducted. So there are three steps of audits. Now we are going towards the steps of audit. Number one is pre-audit preparation. Pre-audit preparation means before audit. What we have to do before audit? What are the requirements, or what could be the procedure that could have been followed, or that could be followed before audit? Number one is time scale. We have to decide and discussed with the management and the organizational leadership that what would be the time scale for that audit. For like we have to consider conduct an audit for 1 month, like in the evenings or in the weekends, or for 2 hours every day. So time scale must be managed. After that, scope of audit must be managed. Like our audit will be of which area, which instances, which things will be checked in that audit. After that, the number three is area and extent to the audits. Which areas will be considered in the audit, like production department, warehouse of organization, or delivery and dispatch area, or like loading unloading area, or storage area, that stuff, or emergency exits, or what type of area we are going to do the audit. And then we will see who will be required for audit. We will check which person are required to be present at the time of audit, like the workers, senior manager. So the auditor can ask basic questions and can make his audit report properly. Definitely he would need some answers from people so that he can make his report. After that, what documents will be required? After that, we check what documents are required. So basically, typically the documents required are health and safety policy, risk assessments, training records, minutes of committee meetings, maintenance records, and details of failures, or records of health and safety monitoring activities, e.g. tours, inspection service. That was the first step. That now the second step is during the audits. Like what could be happening during the audit? What would happen at the proper time of audit? What, like we are conducting the audit, what would happen at the time of conducting audit? So at the time of conducting audit, three methods will be performed. Number one is paperwork. Paperwork record documents that I have mentioned earlier will be checked. After that, interviews. In number one, we have make sure that people, these people must be present at time of audit. Now we will utilize those people. We will interview them. We will take their statement. We will take their we will listen their complaints. We will listen their issues, and we will make record of that. And after that, we will make observation, the personal observation of the auditor. The auditor will go physically to the workplace. He will see there is spill of oil on the place, the machines are corrosive, the machines are filthy, the machines are rusted, the machines are broken, they are not working properly, they are making noises, and that stuff. Everything will be observed about workplace equipment, activities, and behavior. Like the workers are not using PPE, the workers are behaving carelessly toward health and safety, the equipments they are using are not proper, and that stuff. Everything will be observed by the worker physically. And now the third step is at the end of audit. What will be the last step or completion of audit? So after that, we have conducted the audit, like the during stage of the audits has been completed, like, or the middle stage of the audit has been completed, like checking of paperwork, interviewing people, making observation. Now what we will do from all these stuff, we will collect them into form of a written report. This is required at the end to complete the audit. After that, we will discuss these reports, issues, and findings with the senior meetings and management, leadership, and that stuff. So they will be aware of these issues, and their thoughts or their ambitions toward these things or these issues can be noticed. After that, it is responsibility of the manager. Now the auditor responsibility has been ended. Now it is the responsibility of management that these recommendations from auditor in his audit must be kept in view. These must be corrected, these things must be improved, and these improvement must be communicated to all the workers and implemented. The report suggestion, because the report would definitely point out issue, it will point out solution, it will point out those person who are basically responsible for these issues. So the management or senior leadership must implement those findings. And basically audit is also necessary for some certifications like ISO 45001. Now we have 40 minutes. Now we will discuss the benefits and of internal and external audit. So external audit has advantage because the person will be independent. He will not know anybody in the company, and because he won't have any risk of losing his job in case he does his part of accurately, or he must be bribed or given any you know bribe for it in case of money or promotion or that stuff. So he must be fair and independent because of being external to the company. He must have fresh pair of eyes because he is not regular observer or regular worker in the company. He come from outside, point out he will be able to point out the problems immediately. Unlike if there was an internal person, he was used to that problem, he was used to that noise, then he can't properly observe it or properly report it or even consider it as an issue. May have wider experience of different types of workplace. An auditor definitely he had, as he is from external sources, he must have worked for different projects, and he has different you know experience of workplaces. The recommendation often carry more weight because he is from outside and he has more skills and specialized in this field. So his recommendation will definitely carry more weight. What are the disadvantages? So the disadvantage is that definitely as he is outsourced, so he must be expensive. It would be time consuming to find a person, hire him, and you know find a competent one that would understand such job. So it would also consume time. May not understand the business to make practical suggestion. It can be possible that the current business or current organization of whom the audit is required to be done, the auditor is not aware of that. Like if auditor has mostly done uh, audits of food companies, then it would be difficult for him to conduct an audit of oil company because it has its own criterias and stuff and losses and gains, and that's may intimidate workers who get incomplete evidence because as he is an internal person, external person, so most workers are not used to him, and when he will arrive at the spot, most workers will be scared from him or intimidated from him, and they out of confusion, out of lack of confidence, they will give him inadequate or wrong evidence because of being puzzled or that stuff or confused. After that is internal audit. So the advantage of internal audit is it would require him less experience as he is used to his job and situation or environment of the company. Auditor already knows the business, or auditor is already aware of the business of the companies and what things can be achieved because he is in the company. He knows all the situation in reality. So improve ownership of the issues find as he is present after the audit. Definitely he will uh, keep in mind that these things are completed or not, or he will definitely time to time request the management to do these changes, unlike an external auditor who will just conduct audit and go away. Build competence internally. He would be able to build competence internally because now he has find the problems. Now he will able to do work on those problems and will try to solve those problems. So what are disadvantages? May not notice certain issues because definitely this advantages of external auditor are the disadvantages of the internal auditor. Auditor may not have good knowledge of industry or legal standard. Auditor may not possess auditing skills, so may need training. After that, auditor are not independent, so may be subject to internal influence as he is the worker of company. At the end, the organization will pay him job. So now the last part of element 4.1 is review. Definitely, if an audit has been conducted successfully, then it must be reviewed. So the purpose of review is full management system review. Definitely it was all about management system. So the management system will review each and everything, whether risk assessment policy or accident books, so to make corrections. It would be at all level, at management and departmental level as well. So what are the purposes of regular review? Reviewing performance is an essential part of an health and safety management system. It will help us to check whether the company is on our target. If it is not on target, then what are the reasons for its not being on target? After that, the third would be it would be help in what do we have to change. Definitely review will help us identify. Definitely it means in review everything can be reviewed. It comes after audit. So review will give the company overview of its whether its objectives are completed. If its objective are not completed, then what are the reasons for its being not completion, and what can be changed or what can be improved to get those objectives. So these 3 points are that. So basically it is in that in book word it is, are we on target? Number 2 is, if not, why not? Number 3 is, what do we have to change? I have explained that point as well. Issues to be considered in review. So what issues can be considered in review? So we can consider in review legal compliance, accident and incident data, inspection surveys, tours and sampling, absence and sickness data, audit report, achievement of objectives, enforcement actions, previous management reviews, legal and best practice developments. So all these stuffs can be reviewed. So I hope that this would help anybody, but basic purpose of it is to keep record, and so that check how much time I have studied. So I have successfully studied 45 minutes without any pause or break. So these short lessons will help me to gain 3 to 4 hours daily study time. So that's why I am recording that. There is no specific reason other than other than helping anybody who wants to get help because I'm trying to explain something as well. And after that, preparing for an interview as well, because as I'm speaking in English, I have to give interview in English, which is different than my native language. Then it will also help me. Basically, I'm considering that there is viewer is my interviewer, and I'm trying to explain to him as I have to explain to the interviewer in the interview of Nibosh. So somebody else can use this technique as well.